This episode is brought to you by the Soar with Tapping app, created by expert EFT coach and friend of the show, Amy Vince. If you're navigating anxiety, trauma, or just trying to feel more grounded, tapping is a powerful science-backed tool that can help calm your nervous system and gently release the emotional weight you've been carrying. Amy's guided sessions in the app make it very simple to start healing right from your phone. Visit the Soar with Tapping app in Apple or Google Play stores and start your journey towards freedom. Welcome to Bipolar She. I'm your host, Janine Noel. The content of the show may include suicide or suicidal ideation. If you're ever in need of immediate support, please dial 988, a suicide and crisis lifeline. Today I sit down with Betsi. Betsi had always heard that a bipolar pregnancy could be dangerous. There's a 55% chance that a woman with bipolar disorder will suffer an episode while pregnant. She and her husband decided not to have children. But when Betsi accidentally does get pregnant, her fears come true. She has a break from reality and soon finds herself in the psych ward. It would take months for her mind to heal while caring for her newborn with her husband. With small town support, a welcoming church, and her courage to finally face her early childhood trauma, Betsi has not only been stable for 13 years, but she also has deep gratitude for where her life has taken her. Welcome, Betsi. Good morning, Betsi. Thank you so much for coming on the show.
Good morning. I'm glad to be here. Thank you for having me.
Well, great. So I usually just have guests launch into a crisis time in their life, but I feel like your story is very interesting if we go back to the first time you were having manic symptoms, and then we can progress forward from there. I think that would be really helpful to your story.
Yeah. So in May of 2001, I graduated from Texas A&M with my master's degree in higher education, and I took a job in Arkansas. The first 6 months of that job, I was extremely homesick and I wasn't taking good care of myself. I wasn't getting good sleep. I was just running myself ragged. And so in December of 2001, I came home to visit my parents in Ohio. And the day after Christmas, I began to have a panic attack. And I thought I was having a heart attack. So my mom took me to the hospital. They did an EKG, but what they were telling my mom is they thought it was more mental. When my mom took me home, I started to have delusions that I was running for public office and that people were going to find out that I was sick and I couldn't go to the hospital. I was saying things like, "Do you know who I am?" Assuming that I was famous. My dad came home from work and knew that I was not doing well. And from his background in the military, he knew that I needed more help than my family could give me. So they took me to the hospital. And the first couple days are kind of a blur because I felt like I was just coming out of something I didn't understand. I didn't know how I got there. I started taking medicine, and about day 3 is when they told me I had bipolar. And my background in college was psychology, so I was familiar with the general sense of that word. I just was not familiar with what it was going to do for my life and how it was going to alter things for me. I stayed on medicine and I started to get better. And then I moved about an hour away and took a job. And with working with the psychiatrist there, he did not believe that they had my diagnosis correct. He believed that I had something called a quarter life crisis because I was 25 when this happened. So he slowly, over 6 months, took me off of all medication. So from 2002 to 2006, I lived unmedicated. I do not know how. And knowing what I know now, I would never be without medication because I know it's one of the things that keeps me healthy. I listened to the doctor and did what he thought was best at the time.
So you had just had one psychiatric hospitalization.
From December 2001 to April 2002, I was inpatient 4 different times because I would stop taking medicine and then I would relapse.
So your provider at that point ignored those 4 hospitalizations that you had?
He was of the mindset that it didn't make sense to him that out of the blue this would happen. So, yeah, he did not feel like I needed medicine and did not feel they had my diagnosis correct. Once I got off the medicine, I felt okay. I didn't seem to have any symptoms. I wasn't manic by any means, and I worked and I didn't have any what appeared to be any issues. In that time, I met my husband and we were dating, and I tried to tell him what had happened to me, but to tell someone is really hard unless they see it for themselves. And so in 2006, my husband experienced a manic episode with me, and we both, from that point on, never questioned my psychiatrist or anything.
And how did that manic episode present?
I had a meeting with some students and I was talking about a friend who had passed away in college, and it seemed to have me really riled up, and it wasn't making sense to the students at the time. So they called my husband and they drove me home. And that night, I was stuck in memories from like childhood and things that had happened to me. And my husband just saw me unravel completely to where he didn't know how to help. So he said, the next morning, we're going to the hospital. When I walked into the hospital, I was screaming and cussing, and that is unlike my true nature of who I am. So my husband knew something was severely wrong. We finally got a good psychiatrist who has actually been my psychiatrist for 19 years. And he was able to observe me in the hospital. And when I finally started settling down and could understand and hear what he was saying, he said, "You are bipolar. And if anyone ever tells you otherwise, you should run from them, run far away."
Do you get pregnant during the time when you're off medication, or are you back on medication?
No, I was on medication in 2006 and I have not been off medication. I was preventing pregnancy because back then we didn't know if it would be a good thing or a bad thing. So we just decided to prevent, and we had had that conversation. We're going to be okay without having kids. So we were married 9 years and I got pregnant. So we had to go at it very differently and change a lot of my medicine. And a couple months had passed. I wasn't coping. I was struggling. I couldn't understand how I was going to have a baby. And then I had a manic episode, which prompted my husband to take me to the hospital. And then I stayed there for 14 days while they managed my medication. My pregnancy was so difficult because I was recovering from a manic episode and then taking new medicine and not working and just trying to take care of myself.
Were your manic symptoms similar to your earlier ones during pregnancy?
Yes, they were. Like, I seem to have like a break with reality where I'm stuck in past situations that I had been in either from childhood or college. And I just fixate on something and then I talk about it. But I might not really remember, almost like blackout, but I'm still acting out, which is very frightening to me.
Did you feel supported after you got out of the hospital during your pregnancy?
I mean, our families were really happy we were going to have a baby. And my husband is one of the most supportive people. He's just very in tune with how things should be going. And if there's any deviation from my behaviors, he's tuned into that. I had a lot of support. It can take me like 6 to 8 months to recover from a psychotic episode. And then the challenges of taking care of a newborn, it was just a lot of stress. And her first year is just a blur.
I know that you live in a pretty small town in Ohio. And was this the community that you were raising Savannah and bringing her home to?
Yes, yes. We have lived in our house for 18 years. We have a small group of friends that have kind of been there for me throughout.
So, do they know about your mental health history?
My friends that I've been friends with for many years know that I'm bipolar, and we've talked about it through the years. I would say there's a few people at church that know, and I just haven't been widely like out there.
So, you had mentioned that you're part of a Mennonite church now.
Yeah.
I don't know if you identify as a Mennonite, but I find that very interesting. And I did a little bit of research, and actually, I found that the Mennonites created mental health hospitals, actually, even during World War II. So, they have history of giving support and making it a priority. So, how does it feel for you to be part of that church?
It feels good. One of our pastors knows that I am bipolar, and her and I have had some really great conversations. And at some point, I may do like a small group, open it up to the church, but I'm just not ready to be the voice of everything for mental health. I do identify as Mennonite. I feel like, too, I'm a Christian and I can live that out in the church comfortably. I feel very supported. And I don't think if I stood up and shared my story, I would not have any resistance from the community. I think I would be more supported than probably ever.
I know part of your story, part of your journey that you shared with me includes some difficult times as a child
Yes.
and a belief that those difficult times did set you up a bit for bipolar or have an impact on the bipolar presenting in your life.
Yes, I would agree with that. I grew up with an alcoholic father, and he is sober and has been for 36 years. But he drank a lot when I was younger, and it was very chaotic at our house. There was a lot of verbal things going on, and it was very stressful growing up. I did not have a normal childhood. Yes, I had two parents living in the home. They were dysfunctional. And so I would say our family core was dysfunctional. And I do believe, especially when I've had my episodes, I get stuck in some of those earlier traumatic situations, and it's hard to get out of them when I am experiencing mania and psychotic break. I do believe that if I had grown up in a stable, healthy, where there was healthy attachment, I may not have developed bipolar, but then again, I may have. I do believe growing up the way I did led to some mental health struggles that eventually evolved into bipolar, because I think when you're subjected to a lot of stress over time, it changes your chemistry in your body. And I honestly believe that the home that I grew up in as a child definitely affected me as an adult and was one of the factors that I ended up with bipolar. I do believe that.
I think that's so important to say, Betsy, because we are at a point, and I kind of understand it, but if someone is newly diagnosed with bipolar, no one really says, okay, let's take a look at your family. Let's go back
Mhm.
in time and do some deep
Mhm.
psychotherapy. It's basically this is a chemical imbalance. We're going to get you
Mhm.
on medicine.
Mhm.
It doesn't have to do with your family and it doesn't put any blame on anyone, and then do your therapy. So you can just be separate from the family,
Mhm.
take meds, and do therapy. And I just think these other elements in the story of how bipolar emerges within us, I think that's really important. And I think it's kind of amazing that you can talk about it. And I find it still fascinating that, like, in the midst of a crisis, you return to that place of feeling unsafe in a household with things chaotic. So I just feel like there's more of a link than providers let on. Does that resonate with you?
Yes, I would agree with that because a couple of years ago, I just felt like some of those things that I grew up with kept resurfacing. And I started counseling because I said, I got to work through some of this because I don't want to project anything from my childhood onto Savannah where she has trauma that's not really her trauma, it's my trauma. And I don't want to pass that along to her. So for me, getting counseling and staying on medication, that is so important to me. She is one of my biggest motivators for wanting to stay healthy because if she ever has mental health crisis, I want her to have an advocate in me, but I want her to think back of how I manage things and think, well, my mom did it, so I'll be okay. I can do it too.
Yeah, those are some hard issues to face in terms of heredity and these illnesses. I know people get so frightened of it, right? With that statistic of 55% having another manic episode and then passing the genes on to your child. But I believe there is just so much in the nature versus, nurture. I think that nurture element is tremendously strong and very important for us to realize.
I agree with that. Our home life is very different from the home life I had growing up, and it's healed me. I'm not creating the chaos for Savannah to grow up into. So hopefully, when she's an adult, she's healthy, happy.
Absolutely.
I feel like this was a big step to delve deep into my story.
Great. Well, thank you so much for coming on the show today.
Thank you so much for having me.
Hi, it's Janine. Bipolar She is currently an independent podcast. I'm its writer, producer, and host. Please consider this podcast as a work of advocacy, getting important stories to those that need them. As we gather ideas how to keep the show running financially, please do engage with the podcast wherever you find it. Offer up some stars and some likes. You can visit us at bipolarshe.com or at bipolarshe pod on Instagram. And thank you, as always, for your support.